Today I'm going to talk to you about why pterygoid implants are making a real big improvement on treatments for patients. My name is Bruno, I work at the Brighton Implant Clinic, and I'm going to take you through why pterygoid implants is such an exciting topic and making such a good improvement to patient treatments. Pterygoid implants. What are they and why am I so excited that I decided to make a video for you just about this particular type of implants called pterygoid implants. The pterygoid implants are used mainly with patients that have limited amounts of bone in their upper jaw and patients that need a full arch or full jaw of teeth to be replaced. We call it a full arch treatment or like an all-on-X type treatment solution. Many times patients in the upper jaw have very limited amounts of bone, and the bone can also be quite soft and quite limited, some patients having more bone than others. So today I'm going to talk to you why pterygoid implants are making a really big change and big improvement in the outcomes of treatment for patients that need to have a full jaw of upper teeth replaced on dental implants. So for several years we've been using the all-on-4 concept. So basically the all-on-4 concept used just 4 implants, and these were positioned in the upper jaw or the lower jaw. And these 4 implants were using posterior implants that were tilted, and that was specifically to avoid the empty spaces that we have in the upper jaw, known as the sinuses. And essentially these are like empty spaces whereby we don't have bone for those implants to anchor into. So by tilting the implants, these implants can basically bypass these empty spaces and provide solid anchorage for implants and for teeth to be supported on them. Unfortunately, with some patients, their sinuses can be quite large, and when we lose teeth, those sinuses actually get larger. It means that the amount of space that we have for implants becomes reduced, and essentially those 4 implants actually become closer to each other. And why that's important is that for a very long time, we've basically either been looking at patients with a shorter bridge between these 4 implants, which is not ideal, because that means when you smile, especially from the sides, you might see that there are not a full complement of teeth as you would normally see. Ideally, we're aiming for 12 teeth in the upper and lower arch. 10 is usually okay, but at least 10 would be a minimum amount that we would expect. But sometimes it can be quite challenging with those 4 implants quite close together because there's very limited amounts of bone. And in the past, we sometimes would maybe consider using what's known as bone grafting techniques. And these bone grafting techniques basically meant that we used to try and add artificial bone to the empty spaces of the sinus. And this basically took a very long time for healing. The bone quality was sometimes questionable, and in my experience we saw a higher than usual amount of bone graft failures and implant failures in those grafted bone sites. So the benefit of using the all-on-4 is basically that you're not using any graft materials. It's basically just the patient's own bone. And now pterygoid implants have basically come to add an extra additional technique or solution to provide 6 implants in the upper jaw that is going to give you a full complement of teeth. So pterygoid implants are longer implants, and they're placed into the pterygoid plate at the very back, the extremities of the upper jaw, and they are used to complement other implants that are usually placed in the anterior regions of the mouth. So I'm going to show you some examples of x-rays of how the pterygoid implants are positioned. So as you can see over here, this is the normal configuration of an all-on-4. You have 4 implants placed, and as I explained to you, this 4 implants, they basically to avoid this area over here, which is the sinuses. Okay, so you can see we position these implants in this position so that we can actually have a point in this location here, so that teeth can essentially go from right about here to about here. Okay, and we want to avoid extending teeth too far back because that might create unfavorable loading and levering forces on these posterior implants. So these cantilevers here are not ideal. And if you look at this particular patient, come to see us with a view to replacing her natural teeth, and these teeth are already in place. So this patient is used to having molar teeth at the very back, and so having implants and explaining that the treatment's going to be carried out in this way, and with just 4 implants we're going to land up with less teeth. Sometimes it's quite not ideal. So in a case like this, by adding the pterygoid implants, and these, as you can see, they position at the very back of the mouth, it allows us that we can create a bridge that's going to be supported on 6 implants. There's going to be no cantilevers, and it's going to be far more stable and very secure. And remember, as I said, the pterygoid area is actually very dense, and it has good amounts of patient's own bone that usually doesn't recede or doesn't become less dense even after several years or multiple years of having tooth loss. So these areas are generally resistant to bone density changes. So here you can see, this is the previous image was the planning, and this is the x-ray taken afterwards. You can see the patient over here. We had this 4 implants at the front, and these pterygoid implants now at the back, they're basically creating the posterior support that is so important to have a full complement of teeth. The patient was very pleased that she was able to have 12 teeth. It's got quite a wide smile, so when smiling there are no spaces on the sides, even with a really wide smile. This is what the bridge would normally look like when looking from the occlusal view, from the inside view. And you can see over here, this is the normal position of where the all-on-4 implants would be. So you can see with minimal levers, ideally the bridge shouldn't go beyond this point over here. We can go a little bit further on this patient's left side, but we want to avoid those levers as much as possible because it could make the bridge prone to breaking, and the implant itself could be overloaded because of those additional forces that are created when we have levers. So the pterygoid implants placed in this position over here, you can see it's a really good solid posterior support that basically provides the confidence and the stability for these implants to be joined together and working really well together. This is the bridge fitted in the mouth, so you can see over here the pterygoid area is right at the very back, and usually we don't place teeth in this position because it can be sometimes quite uncomfortable, can encroach on the patient's cheeks when biting together. So we usually aim for 12 teeth, even with pterygoid implants in place. When we remove the bridge, you can see these areas on the outside of the implants, they're nice and healthy, and the tissues generally adapt very well to the implants if the treatment's been correctly planned and executed well. So again, you can see the span, trying to stress this area. This is kind of where the normal bridge would normally go to, but with the pterygoid area, we're able to go right to the very far back. So it provides a really great solution. Here is another interesting example. So with this particular patient, again, patient's bone density and bone volume was quite limited, and we really needed pterygoid implants. So what we did is we actually planned to do the pterygoid implants first. And so you can see the patient still continued with her natural anterior teeth, even though we were planning to place a all-on-4 treatment. And here the pterygoid implants were placed at the back first. And in this case, we waited 8 weeks for the pterygoid implants to integrate. And then once we had confirmed that they were suitably anchored and integrated, we then proceeded with the all-on-4 in the usual positions, as I show. I'm going to show you in the next slide. So that we place these 4 implants at the front, and you can see over here. So this is a really great example, again, just to show you that with just the 4 implants at the front, it would have been, I think, a substandard or suboptimal treatment solution with teeth that wouldn't go further back. And in this example, we were able to, again, deliver 12 teeth thanks to the advent and the great advantages of pterygoid implants. This is the final X-ray showing the implants all integrated, very nicely positioned, and then the pterygoid implants at the back. You can see quite a long span here. And again, this patient's still maintaining lower teeth, so these lower teeth still have function. And so it really highlights the advantages of pterygoid implants. So here is an example of an upper implant bridge on 6 implants. And as I showed you on the x-rays, you can see these posterior areas over here are where the pterygoid implants are positioned. And it basically gives us a full complement of teeth, essentially 12 teeth, and it gives really great support in those posterior areas where normally in these premolar and molar areas, patients have very soft bone, very limited amounts of bone because the sinuses tend to be quite large in those areas. So this solution over here on 6 implants is only made possible with the positioning of these pterygoid implants that really makes this treatment possible. So to summarize, pterygoid implants are great because they reduce treatment time. You're using only the patient's own bone, which is always more responsive and better quality than any grafted bone. So the main benefits is not needing sinus lifts or bone grafting procedures, and the procedure itself is a little bit more complex than conventional implant placement, but provided it's being carried out by an experienced clinician that has been doing pterygoid implants, it's going to provide a really great solution to missing teeth.